So in addition to the eye exercise and the eye testing, stuff like that, one of the first things you did to me was acupuncture.
Yes.
What is the belief behind all that? How does all that work?
I've been practicing acupuncture for close to 40 years, and I don't practice it truly in the traditional way, because acupuncture is going to initiate, when you put it in the skin, it's going to initiate signals, all right? Anyway, the pain receptors, in areas that you injure a lot of times, your body has built up extra pain receptors to protect you, because when it heals with scar tissue, and it's not as stretchy and stuff. But anyway, if we inhibit those pain receptors, they'll die because they have a half-life. So if we get rid of those extra ones, you're not as liable to keep re-injuring in certain areas again. Does that make sense?
Oh yeah.
And then we go about strength. You take care of the strengthening, and you got Cal Deeds doing it with you.
Right.
So we get the part of your body that's automatic, the muscle tone, the things that work without you even thinking. I don't know, a lot of people realize for a person to pour a cup of coffee, you got 41 muscles working.
Yeah.
And they got to be coordinated, or you're going to pour coffee on yourself every time you go.
And one of the things that we use adjustments, spinal adjustments, but the way that we do it differently, because we look at the imbalance in the brain, and then we link our adjustments into that imbalance, which very few chiropractors do.
That's right.
So I think that makes a big difference, especially because if you don't, you can maintain the imbalance, and therefore you kind of undo a little bit of what you're trying to get done.
So it's more of, rather than just fixing the symptom, you're fixing also the problem as well.
Exactly.
Especially
underlying weakness.
That's the kahuna.
Yeah.
Yes. Oh yeah. That's what you need. So and then
we're just glad that you're doing well.
That's right. That's right.
And that you found us.
I'm glad I found you guys too. So moving forward, in terms of other stuff that we did, or other stuff you guys do and offer in terms of treatment, the traction table, very interesting with the vibrations and the roller and all that stuff. How does that stuff exactly play into getting healthier?
Well, basically, how your brain develops, it develops from stimulation, and the majority of the stimulation that goes into the brain comes from nerve endings in your spine. So anything that you do to your spine is critical, because it is the major driving force that activates your brain. So that traction machine is just a general way of activating it. Now we make it more specific, because we'll have you listen to a tone that drives one hemisphere over the other, okay? Or we may have you do something a little bit different with the EMS pads, the electrical muscle stim. We may put it stronger on one side over the other, but it's just a great way of boosting your system.
You guys have been the most, by far the best doctors I've ever worked with.
Well, thank you.
Yes, because, and I think it is because of it is because of the holistic approach. It's I come in and I do not just an adjustment or not just acupuncture, but all sorts of different things, the traction, the tones, whatever it might be. It's a combination of things, and it's like you said,
and it changes.
And then one of the other things that they've worked on with me, not just is they've taken a sort of different approach, and not just that they want to get me back to health, but Dr. Stussy and Dr. Klotzik are trying to get me to the highest level of performance possible. And besides all the typical adjustments that we've just spoken about, they've also included the metronome.
It's called an interactive metronome.
Interactive metronome. But yeah, so they're focused on getting me to the highest level of performance possible. So if you'd like to elaborate.
As an athlete, it all comes down to milliseconds and microseconds. That's what separates a sprinter who wins, who doesn't win, right?
Exactly.
And so it's all based in timing. So there's a device that we utilize. It's called the interactive metronome, and what it is you put a sensor on your hand, you listen to a metronome beat, and you create different movements, and you time it to that beat. Most good athletes are usually going to be about 25 milliseconds off the beat. No one's 100% on, everyone's just a little bit off. So if you start getting an athlete who's like 70, 80, we've had in the hundreds, and it really affects their timing, you can just imagine how that's going to affect their sports performance.
Exactly. I believe when I came in, the first time I tried it, I was in, I believe, the 60s to 70s.
Yeah.
And then just today, I think I was averaging about 25 to 30. So I've improved over time.
Yeah, so now when you're
yourself.
throwing,
exactly,
you're just going to be that much more accurate. You won't be able to necessarily discern it. It'll just feel more stable for you.
Yes.
Because your timing's better.
And that's what, like Dr. Klotzik was saying, in movements such as sprinting, especially throwing the hammer, where it's so finely tuned when it comes down to rhythm and position and timing and all that stuff. every little millisecond counts,
Yep.
and that's what makes the difference between
And in the right
winning and
order.
losing. Yes, in the right order as well too.
Yep.
So yeah, this is groundbreaking stuff here, guys.
Yeah, it actually is.
But yeah, and then another thing I had a question about was the tones.
Okay.
These little sounds or tones, whatever you might say, you guys have me listen to when I do. I think it was acupuncture whenever I sit on the track or lay on the traction table. What do the tones do for me? What do they do for any brain imbalances you might have?
Well,
You can start off.
Just about everybody has one side of the brain that's not working as good as the other. Sometimes it can affect your personality, it can affect your strength. Everybody knows that the left side goes to the right, or most people do not. So we found tones that will make that are very specific for one side of the brain or the other. And so you've got this weak side in pain. If we put a tone there, all of a sudden, you know, it didn't hurt as much. So we knew that was helping the brain organize it. Because it's all a matter that it has to get organized. And like Dr. Klotzik is an expert in that, so we just find the areas that we coordinate your recovery instead of just letting it happen.
That's right.
Yeah, the brain, the left and right sides, they process different frequencies. So what we did is that we found different tone frequencies that were more specific to the right brain and the left brain. And then we use that in a recovery basis by having athletes listen to it.
Yeah. So when you're using something, especially at the border of what you can do and you can't do, and we have the tones, because anything you're trying to create has to get organized in the brain for it to be. You're learning a new skill. So if we give you those tones, that's going to help your brain organize itself even better.
And the other part in that is that the areas of the brain that get activated tend to be the more front parts of your brain. And that's really good for recovery because it activates your parasympathetic system, which allows you to recover more quickly from, you know, very, you know, intense athletic training,
That's right.
etc. That's one
The
of the big
parasympathetic
things.
is kind of your automatic nerves for fight and flight.
That's right. Yeah, rest and digest. Right.
Yeah, rest and digest. You know what I mean?
Yeah.
So we know that Cal uses them quite a bit.
Oh yeah.
In his training regimes, he's noticed improvements in heart rate variability, processes, and all that stuff. So we just incorporate them in a whole bunch of different ways here.
It's kind of interesting. Like if you broke this arm and you had to not move it for a while, the place it goes to in this brain would kind of fall asleep, you know, because it's not getting stimulated. So then the arm gets healed, and if you don't do something with this, now you've got this weaker area, so you may not recover fully with this. But also, this side creates a tone for this side to hold your knee in place, your ankle. So a lot of people, you know, have an injury, and then they'll have trouble with this knee over here because this is not holding your knee stable. So there's one injury, even though it looks like it's recovered, if you don't take into consideration the altering of the organization of the brain, you are prone to get another.
Yeah, so if you guys are in the Minnesota area, this is where you need to be. Minnesota Concussion Chiropractic Arts.
Yeah, and if it's
Athlete, general population, doesn't matter. They can make your injuries better. They can take your performance to the next level, whatever it might be. Yeah, I will link their website below in the description, so be sure to stop by there and check them out. If you guys have any questions for Dr. Klotzik or Dr. Stussy, drop them in the comments below, and maybe we can do another video sometime.
Yeah, that'd be great. All right,
Cool.
thanks for listening, guys. Appreciate it.